Hi, I'm OK, and you're in the stream. Today, India continues to be crippled by the second surge of the coronavirus. We'll take a look at three aspects of the crisis, and we want to hear from you. You can jump into our YouTube chat, and I'll bring your comments into today's programme. We start with the helpers. Throughout the global pandemic, it's often been volunteers who have ushered us through some of the hardest and lowest points. This is Pyare Khan. Have a listen to why he decided to volunteer his services and millions of dollars.
एक ट्रांसपोर्टर होने के नाते मैं देख रहा था कि नागपुर में बहुत सारे लोग मर रहे थे और एक ट्रांसपोर्टर होने के नाते मैं क्या हेल्प कर सकता था। तो मैंने श्री नितिन गडकरी जी ने एक आह्वान किया था लोगों से कि भाई आप क्या मदद कर सकते हैं। तो मैंने सोचा कि एक ट्रांसपोर्टर होने के नाते मैंने टैंकर्स अरेंजमेंट किए जो पूरे इंडिया में नहीं थे। तो बेलारी, विशाखापट्टनम, उसके बाद तुम्हारा राउरकेला, भिलाई, यहाँ से टैंकर्स अरेंज करके मैंने यहाँ पे नागपुर में ऑक्सीजन लेके आया। एक मुस्लिम होने के नाते क्या है कि हम लोग हर साल रमजान में एक ज़कात फंड निकालते, तो उसमें से मैंने कुछ 85 लाख 1 करोड़ खर्चा करके ज़कात के नाम पे ऑक्सीजन ले आया।
Another group giving their services to help are Sikh volunteers. Across India, they are coming together to help people in need, filling holes that the medical system cannot plug right now. Joining us from Cuttack is Ronak Singh. He's the founder of Sikh Aid. Ronak, thank you so much for joining us today on the stream. This is a story that's not necessarily getting out from India, which is what Sikh volunteers are doing. Give us an example. Tell us the story of the services that you're providing.
Ma'am, we are providing oxygen cylinders to home quarantine patients, home isolated patients. Like as we all know, during if a person gets affected by COVID-19, the major issues is breathing issue. So we provide oxygen cylinders to home quarantine patients. We provide the service 24/7. If anybody at midnight also needs oxygen, we provide them oxygen. If at all they need any medical assistance, we try our best to connect them with doctors. We all know that hospital beds are full. Patients are not getting best hospital facilities. So we are trying that staying at home, they get best services with best oxygen, whatever we can provide.
Well, will you give us an idea of what a typical day is like for you right now?
We work 24/7. We have divided our shifts within our volunteers. Average after midnight, we get more calls. On an average, we get 300 to 400 calls for oxygen cylinder. It was lesser during first wave, but after now as second wave, we get around 300 to 400 calls daily. And we try to fulfill everybody's need.
Tell me about Oxygen Langar. I keep seeing Oxygen Langar online, and it's a great thing. Explain.
Yeah. Like we all know, Seva is in our DNA. Like we try our best to do everything we can. During first wave, we provided Langar Seva, like we provided good food to migrant workers, daily wage workers. But now at present, oxygen is the main shortage. So we are trying our best to provide oxygen to COVID patients. And in every possible way, we are trying to help COVID patients. Be it providing medicines, be it providing oxygen.
Ronak, I want you to explain what Sewa is. Every Sikh in the world will completely understand what Sewa is, but it will be a new idea to many people watching the stream. Can you explain Sewa?
Like as our guru teaches us, Naam Japo, Vand Chako, Kirat Karo. That means take God's name. Kirat Karo means do good deeds. And Vand Chako means give your 10th part of your earning towards Seva. Seva means helping anybody. Yeah.
I'm going to play some of the other helpers because it's not just Sikh communities around India who are helping. Many people are doing so. Have a listen, have a look.
At Oxygen for India, we're working to solve the last mile challenge of getting medical oxygen directly to people in their homes and in small hospitals. Right now, we're looking to provide oxygen cylinders and oxygen concentrators in 7 of the most hard-hit cities in India.
Last time around, ActionAid Association reached out to over 7 million people in the form of food support and other linkages, but also linkages to the pandemic-related entitlements. This time around, we are working with marginalized communities and those who are grieving and in need to connect them with helplines, to set up helplines, and also to ensure access to rations and other utilities and essentials that they may need.
Our team is working tirelessly day and night for COVID-19 patients in NCR, capital India. We are providing oxygen concentrators to the people who are affected with COVID-19, and we are getting thousands of requests in only NCR region, and it's very heartbreaking to see people have to wait outside the cremation ground to get the family member cremated.
Ranat Singh, you are not alone, but we will leave our conversation there. Thank you for your time, and we wish you the very best with your work. Now, as India fights the surge of coronavirus, another front has opened up on social media: misinformation. Shauna Davis is a misinformation specialist, and this is what she shared with us earlier.
Often videos are taken out of context on social media and shared to push forward a particular false narrative. That's been happening with regards to India as well. This video has been shared on Twitter with false claims saying, for example, that there isn't any lockdown, trying to undermine the severity of the COVID-19 outbreak there, but giving no more context, for example, where or when this video was taken. So I took different screenshots and frames from the video to find, for example, storefront names. From there, I compared Google Street View to the building structures to find identifiable features, and I found that this was taken in the Kaur market in Bengaluru in India. I then looked for videos uploaded over the past couple of days from that location to find the original user, the person who first uploaded this video onto social media. And he said that his video was taken out of context. He was actually looking for stricter lockdown measures rather than suggesting in any way at all that there isn't a severe situation there.
Last week, the Indian government ordered Twitter, Facebook and Instagram to block about 100 social media posts criticising its handling of the surge. Joining us now, Arun Deep is a journalist of Media Nama. Arun, thank you for joining us. Good to see you. There's a story that you broke quite recently. It was a huge story and a scandal for social media platforms that agreed to censor people's conversations online. Tell us about that story. I'm just showing the page right here so people can read the headline and see what you've got up to. Go ahead, Arun.
Absolutely. Thanks for having me. So the story is essentially that the Indian government, which regularly contacts social media platforms to take down things related to hate speech, whether it is targeted at certain communities. And this time around, it was purely political speech that was targeted. It was criticism of how the government was handling the pandemic. One of the tweets essentially said, hey, we are having 200,000 cases a day now, and we are not really seeing any action being taken. Where is the government? It is this kind of pure political speech that you don't even think about that got censored. Now, granted, that was just 50 tweets, but the precedent this sets is really not something we have seen before.
How did you find out that this was happening?
So Twitter in particular discloses the takedown notices they receive from the government to a database called the Lumen database. And I keep an eye on those disclosures. As soon as that disclosure came in, I immediately noticed that, okay, this is insane. This is not like any other requests I have seen before. To their credit, Twitter does disclose this. Facebook and Instagram and YouTube, they don't do anything like this. They refuse to comment for this story. The only reason we know that they were approached to have these posts taken down is because the government anonymously told certain news organizations that they did that.
So this connects up to a change in regulations for social media platforms in February. Nobody paid much attention to it at the time. Why should we be paying attention to it right now?
Absolutely, because the incentives that the new regulations create are really perverse. They require social media platforms to take down content that is flagged to them within 36 hours. And the kind of penalties that these new regulations have for social media companies, their employees in particular, mean that they are just incentivized to take things down and then look at whether they should have been taken down a little later, and that kind of really sets the ground for a lot of censorship of real-time conversations that are really important on social media.
So yeah, that's the next thought that I was having here, Arun, is the impact during India's second wave if authorities in India deem it necessary to censor certain posts on social media. What is the end result of that happening?
So surprisingly, it is not just criticism of the way the situation is being handled. We have also seen some really unusual results as well. For example, in Uttar Pradesh and Delhi, police essentially reached out to citizens who were posting leads for things like oxygen cylinders and beds and said, hey, you cannot post this online. It's illegal under the Epidemics Act. We will prosecute you if you keep this post up. And that kind of discourages people from finding assistance at a time when it is so hard to find medical attention. And that is also one unexpected outcome on top of just censoring criticism.
If you're looking at the positive and what's happening on social media, and not the censorship as far as India is concerned, there's a lot of help that is happening from one citizen to another citizen, a lot of free services being offered. Talk to us about that, because that is really, that stood out for me for sure.
Absolutely. So we have seen something really incredible happen over the last couple of weeks as the second wave started raging. People started reaching out on social media and people started offering help on social media. Right now, we see 24/7, people of all political colors and organizational backgrounds kind of step forward and say, hey, we have oxygen that we would like to kind of deliver to these places, and if anyone needs ventilator assistance, you can go there. And it's incredible how quickly this is being constructed at a time of extreme scarcity and stress on the healthcare system.
Arundeep, thank you for joining us. This is a story that we are going to continue to watch. Thank you. Now from online to the doctors on the front line.
The situation this time around is excruciatingly more painful because young people are getting affected and entire families are getting devastated. The rate of infectivity is definitely higher this time, and therefore the hospitalization rate has increased substantially.
The government of India left no stone unturned to educate the people about same. Innumerable campaigns have been run. Door to door, people have been educated about the preventive measures to be followed and about the vaccination. But we're hoping the situation improves soon, since the vaccination campaigns are running at a great pace.
Our biggest strength is our manpower. All the frontline workers and doctors have been working really hard against this pandemic at a great personal expense. India, time and again, has provided other countries with oxygen, vaccines, and other medical supplies. We urgently need those supplies right now.
We are joined by Dr. Zainab Ahmad in Bhopal and Dr. Mohib Hussain in Hyderabad. Hello, doctors. Good to see you. Thank you for staying up so late to talk to us live here on the stream. Dr. Ahmad, if you could explain what was happening in India right now. What is the situation, the cases, what are you seeing? What would you say?
We are getting almost 4 lakh cases a day, and what I can see is that over the past few days there has been a plateauing. The cases are not increasing exponentially, but however, even these 4 lakh cases per day is going to put a tremendous strain on the healthcare system. Even if a minuscule number of patients are admitted, but they require admission for at least a week, or maybe even 2 weeks, or maybe 3 weeks, then that is why the healthcare system is getting overwhelmed. We have tried to ramp up our infrastructure, but whatever is possible in this short time, we all know that we had been a little bit lax from February onwards in maintaining the precautions. There was precaution fatigue. Even we doctors, some of us were tired of wearing masks the entire year. All those things, they led to the surge. We all know what is happening right now. But it is because of the sheer number of cases that the healthcare system is not able to cope up. Still, we are trying our best. We have recruited more manpower. Today, PM Modi has announced that we can involve MBBS students and nursing staff in COVID care. Let us see how beneficial it will be, but at least we will have some more working hands to take care of the mild cases. So there are a lot of things that we're doing. We are converting entire hospitals into COVID hospitals. For example, my own hospital is now a 500-bedded COVID hospital. So we are dealing only with COVID patients.
Right.
So that concentrates the expertise in a particular hospital, and that is quite good for the patients also, because the patients know that we have to go to this place, and depending on the surge at that time, we are able to give better care and give oxygen, give all the emergency care that is required.
Dr. Ahmad, I have a lot of questions from our online audience, so take a pause for a moment. Dr. Hussain, I'm going to put some of these questions to you so that you can maybe help our audience with some of the issues they're having. This is Shitao. She says that both her sisters are in hospital, struggling for their life today. I lost my uncle, and 2 days ago I lost my auntie. I am scared, so is my family and every single Indian, hoping for the best. What are you hoping for, Dr. Hussain, for right now?
As far as finding a bed is concerned right now, in extreme of cases where the patient has approached for finding a bed in the extreme stages of foreign saturation, so to less than 60% or 50%, and it will directly need an ICU bed with a ventilatory support, which has its own limitations across the country. There are limited number of ICU beds and ventilators in the private setup and the government setup as well. So we suggest citizens of India to be connected to a doctor, qualified doctor who is very well versed in treating this COVID crisis at an early stage, rather than running for finding a bed at the extreme stage of gasping condition, where you will need a definitive ICU care and ventilator, which is limited in a country like India with its limited resources. So connecting with the doctor at an early stage and trying to procure a bed as early as possible, trying to get an intervention as early as possible will definitely prevent an ICU admission if you are there at the right time with a qualified doctor.
All right, so Dr. Hussain, I have two doctors. I'm fortunate here on the scene to have two doctors. The idea about when do you go to hospital and you have COVID-19, when do you go into hospital knowing that the hospitals are struggling in India right now? When should be that time?
I think you should monitor your oxygen levels as soon as you know that it is COVID, or as soon as you suspect that you have a respiratory illness. Any cough and cold, you suspect that it is COVID. Try to get the test early on. And when you're monitoring the oxygen, if it drops, suppose you have an oxygen level of around 99, and it drops to 92, 93, so you go immediately.
So that means, Dr. Ahmad, though, you have to be able to, you have to have that little device that measures your oxygen, otherwise you will not know this. Dr. Hussain, anything to add to that about when do you go into hospital? When should you be there?
Yeah, definitely everybody should have a pulse oximeter device in their houses in this stage of a pandemic right now, and everybody must be taught to use that device correctly and how to measure the saturation, which is easily visible on the device. And second thing, every family should have a family physician, and they will have a family physician, community physician with them around them. Area hospitals are also there equipped with doctors. They can have a visit, or otherwise there are many NGOs and voluntary associations running up for online medical consultations through video calling. They can connect to them easily with the earliest symptom and try to differentiate whether this disease is related to COVID or is it something non-COVID. So the doctor will be very easy. It will be very easy for him to find out and distinguish, and they can guide them in a better way to how to go ahead with the disease. So there are numerous ways to connect to a doctor and a family physician nowadays, and every association, they are bringing up different modalities of connecting with the public just to help them out in this crisis.
Dr. Ahmad, we have all seen pictures of people struggling in India in terms of just oxygen cylinders, getting oxygen. the health system collapsing in some places. This has actually started a whole load of international aid. Have you seen any of it yourself yet? What is the impact of that global story happening and then aid coming into India?
Personally, in my hospital, we are fortunate to be quite well equipped, and but I've heard stories from my colleagues and relatives calling frantically with dropping oxygen levels. But I'm not sure about how the aid will be distributed. Let's hope that we get our act together and we are able to, provide aid to the hospitals that need it, because it is very difficult for the patients and their relatives to manage everything at home. That one cylinder, which has 550 liters, it gets finished in an hour. So how will the relatives run about for, so many cylinders per day? Suppose that cylinder is running out in an hour, so they need 20 cylinders or 25 cylinders. So ultimately, the hospitals will have to be ramped up, and we can open community care centers. Like in Delhi, they have opened some of the sports complexes and they have converted into beds. So I think we'll have to ramp up really quickly to cater to the expected load.
All right, so let me go to Hussein Hasnani. And Hussein, thank you, is on YouTube right now. Hussein says vaccine hesitancy is a big issue, especially in rural areas in India. I belong to a village where we have many doses getting wasted. There is that thought from Hussein, Dr. Hussein, and I want you to listen to this video comment and then react to it immediately. Let's play it.
Seeing a lot of misinformation about vaccines, something like vaccines will mix with the DNA, vaccines are responsible for the mutations, fear of the side effects of vaccine, like the clotting thing that happened in Europe. And I think we really need to systematically address these concerns so that we can reduce vaccine hesitancy and fear among the people. We really need to speed up vaccination and have a huge vaccine uptake so that we can effectively fight this pandemic.
Dr. Hussein, your thoughts?
Yeah, as regards to vaccination is concerned, there are many doubts in the common citizens of India regarding vaccines. So based on the different companies which are manufacturing vaccines, it's only the company manufacturing that is different. The efficacy levels which is being talked about, that Siemens or Institute of India, for example, and Pfizer and different companies have different efficacy levels, but the protection will be definitely there against the virus itself. So I request the public not to go around the efficacy levels of different companies and choose the vaccine. Right now, whatever vaccine we are getting, they are very much safe enough for inoculation. And whenever there is a chance of getting vaccinated, then as soon as possible, one must get vaccinated. Because as of now, only 2% of Indian population is vaccinated with the second dose of any vaccine, let it be Covishield, let it
people online, excuse me, Dr. Hussain, people online are saying, how is this possible? These are Indians saying, how is this possible? We are the vaccine capital of the entire world. Why are we in difficulty right now?
Yeah, the problem occurred when the production of vaccination was not matching the demand of vaccinating. We are a country of about 1.4 billion people population, and out of that, we have been able to vaccinate only 2% of the population, and the remaining we have been exporting the vaccine or helping to other almost around 44 to 50 countries, which is also very important to help them around. But the production of the vaccines should have been ramped up equally after calculating the amount of huge population which India has already. So that has been failed to actually match the supply and demand.
Dr. Mahib Hussain, thank you. Thank you so much. And also Dr. Zainab Ahmad, we really appreciate you. Two doctors on the front lines of the COVID-19 second wave in India, making time for us here on the stream. Doctors, thank you so much. We have to leave it there. So we will continue to cover the story of coronavirus in India. Please stay tuned to us. And if you would like us to cover a particular angle of a story, do let us know. We're always on Twitter 24/7 @AJStream. See you next time. Thanks for watching.